everyone and welcome to UKAP Airsoft. I'm your host Charlie Tango04 and today we're going to be talking about my IFAK or my individual first aid kit. So as you can see here, I've got it nice here for you, and yeah, I'll be talking about the reasons why I carry one and everything like that. And yeah, so I mean, we'll start off with the reason why I carry it. So you never know when someone's going to need any first aid. Would this be just regularly, like in real life? Just like you're walking around and obviously someone has a fall or something, you've got something in here that could help them out. Obviously on the more extreme note, if someone was to get stabbed, I do have some things in here which would obviously be able to help with that. And then general, you know, first aid, things like plasters and wound wipes, etc. So that's why I carry this. So if I'm on an airsoft field, everyone has the chance of getting hit in a place where their skin is a bit thinner, so obviously that might have a chance to break skin. So here's a really nice way of obviously being able to help someone in that sense. So I'm going to cover what's inside, obviously, everything like that, and then I'll talk about kind of where I have it on my plate carrier. So yeah, so the reason also why I carry it is I am basic life support trained as well as advanced cardiac life support trained, meaning I have things with CPR, defibrillation, etc. So I do have training to use all of these. I'm not certified anymore, however I was certified previously, hence why I have my training done. So yeah, I cover everything. So I'm just going to cover one thing that I don't carry in my first aid kit. Well, I have one in my first aid kit, but this is just another one. And that's just Cpr Face Shield. I've just nicked this. I nicked this off my mum, but it's again just a regular Cpr Face Shield, and I get it out to show you really quick. So not being used, but all it is just a lovely bit of plastic. You put it over someone's face with the lovely one-way valve, and all that does is that just allows you to give them some, or give someone rescue breaths should they be in cardiac arrest. Now you will really want to do rescue breaths in more of a respiratory arrest sort of issue, so someone's choking, drowning, etc. That'll be when you want to do your respiratory things. That's when you want to do your breaths as well. It's not necessary in like regular cardiac arrest, however in respiratory arrest I would definitely say, and I think everyone would say, use rescue breaths. And that just has my key, my letterbox key on there as well, and that just attaches where my gloves are. So now to onto the thing. So as you can see, we've got the gloves on, we've got just a lovely little patch in the front, and I'll open it for you. So this will velcro onto one of my things on my vest, and here we have this. So let's take out this other flap anyway. So as you can see, it's quite big, and I'll run through each and every bit that the things I carry on it. So on this side we have a normal saline solution. Same with this one, both of them are normal saline, so both can be used for things like irrigation, different things like that, wound irrigation. This one's a bit bigger, and then obviously you've got just a little bit of a smaller one. So this one I believe is 50ml, and then the other one is 35. So again, both have their uses and both are really, really nice to use. On this side we do have eye wash, pretty much the same thing, sodium chloride solution. Again, both 35ml, so if you did need to use wound irrigation, or sorry, these are 15ml, but should you need to use them for wound irrigation, you're more than welcome to use them. And the other one, 15ml, I do apologise, not 35. Next we have some zinc oxide tape, which I'm going to take out, hopefully, if it's not going to be a dick. So, and that's just down by an elastic strap. So, zinc oxide tape, really nice tape, really sturdy, and it keeps itself nicely. Would recommend picking it up. I got this from Boots, as you can probably see from the inner thing. Got it from Boots. I think it was worth a 3-pack, and it was really nice. Some gloves. I've got 2 sets of gloves in this part. As you can see, I've got some more here. And then this is my more traumatic stuff in the front. So obviously you can probably see the 2 bandages up there. That's the smaller things. But these are more my trauma setting things anyway. So I don't have a tourniquet. I do need to get one, or tourniquet, sorry. In here we have an iPad, and no, not the one you use to type your shit up on. This is a basic thing just to cover an eye if it's got anything inside it, or if someone's had like a scratch retina or something, scratch cornea, different things like that. Really, really nice thing to have just to keep their eye covered and prevent any more damage from happening. Then we've just got a few non-sterile pads, or non-adherent sterile pads. Just basically a gauze pad. Really, really nice stuff to use on, especially on small wounds, small lacerations as well. Just to keep it covered and get rid of dirt. And yeah, really, really nice. And some bigger ones. These are again just non-woven wound pads. These are sterile, and again they're just thick gauze pads. You can use them on bigger. So yeah, avoid fingering side to be used, which is what they put. Again, that's just to prevent any infection or anything like that going into the wound. But again, if you're wearing gloves, just maybe give yourself a spray of some sanitizer as well. If you've got any spray sanitizer, just keep your hands nice and clean for the patient. And yeah, really nicely, 10 by 10 centimeters or 4 by 4 inches, and it's a 4-ply thing here. And then we've got 2 abdominal combine pads. So these can be used in things like stabbing and things like that. And it basically just helps absorb stuff. So it's again, nice sticky side, and then basically you just attach that to where they've been stabbed in a sense, or where they've got a giant hole, and you can use that to try and stop the bleeding, again by applying pressure as well, just to ensure that everything is nice and secure. Again, holding pressure and applying pressure is definitely something you want to do. And when it's obviously in the abdominal area, if you were to obviously try and pack it, unfortunately you're not going to get very far if it's in the abdomen, because it's just going to go in between all your lovely organs that you've already got. So again, always nice to have these to cover it up. And that is my thing, apart from these two. So these are just a bit larger conforming bandages. So the elastic conforming bandages. I've got 2 of these, and that again is just so I can use them trap up, and then some steri strips as well. These are, I mean, less for trauma really, but again they are just to close the skin off should you need to for any reason. Again, if someone's got a major cut. And then there is another bandage roll in here. So both of these go in here. So naturally I'm going to have to take these out because they go in last, as well as steri strips. And again, really, really nice stuff to have, and that just goes in pretty much size order. And yeah, it's really, really nice again to have all of these things just in case. And again, in a traumatic situation where obviously in Airsoft, if someone gets inhaled by a tree, because a lot of obviously those things are out and about, it's a lot better to have certain things like abdominal combine pads that you can wrap around certain things. You can also slit holes in to obviously make enough room for these sorts of things, such as obviously a branch or anything like that, a stick, anything that's jabbed inside a patient. You can use that, yeah, trauma shears, which I don't have on in here because they're on my persons. Obviously use that to make a slit inside and just be able to prevent things from happening. I do apologise about my voice as well. I've been drinking a lot, so my throat keeps getting dry randomly, because obviously if I don't drink anymore, so I do apologise. Then we move on to our more general stuff. So this still has 2 conforming bandages. They're smaller, so you can use them on a hand or things like that if there's a hand injury. If it's not really too, I would say, life-threatening, I suppose. And again, we've got 2 more iPads in here. Again, but this can be used as well. You shove it up a nose if you roll it up. Or you can use something like a tampon. So I have these because I get nosebleeds like no fucking tomorrow. So they're always really nice to have. We've got some adhesive wound dressings again for something that's not as severe, but something that needs to be covered up. Some adhesive wound dressings. Some non-adherent sterile pads. These are just, again, gauze pads that you can just shove over someone's wound should you need to. Another big thing, as well as another gauze pad, or another 3 gauze pads, sorry. And then one more of the big ones that we've got. So if I do need to replace them, I can just take it from said thing rather than having to worry about buying some more. So obviously I will restock this should I use too much of it. So obviously if I use any of these pads or items or anything like that, should I run low, like one, I will definitely order some more, but as of right now, perfectly fine. I'm also trying to make sure that it goes in the right compartment, because sometimes if you don't put them in the right compartment, it's going to get mucked or muddled up, and you don't really want that when it comes to your equipment. When you think that you've got like a more, let's say, traumatic capable kit in terms of these, and obviously you pull out something that's not capable for that. So we're going to go put these back in. So again, eye wash was on this side. I think I'll probably get comments later in a minute saying no, you're wrong, it was on the other side, and to you I say go fuck yourself. Again, as long as it's within like the same parameters of where I had it before, so everyone knows, it's always good. But should people obviously that attend any airsoft events that I go to see this video, you know exactly where I keep my stuff in case you need to perform first aid on myself, or you need to borrow some of my equipment. I just say take the kit and go wild. Preferably don't actually use everything inside, or at least ask for input on what you will need to use, or I could just, you know, do it myself. But again, sometimes if I'm in a rush or anything like that, I'll just say take my first aid kit really quick, use it and stuff like that. So with these are really fucking finicky trying to get these gloves back in, but again, doesn't really matter if they're that neat. And then zinc oxide tape, so this is the bit that's the pain in the arse, but it's what it is. There we go. So zinc oxide tape's in place, we're just going to do that. Boom. So we're going to now focus on this part. So in here we have a few things, and obviously I'll focus up here as well. We've got an emergency blanket, so you never know when someone's going to need to keep warm. So if in a traumatic situation where someone loses a lot of blood, their body temperature will drop. They may feel warm, but again, that's because they're soaked in blood in a warm temperature environment. That doesn't mean their body temperature is okay. So unfortunately they may get a little bit hot in this, but if it's a warm day, definitely you still need to wrap someone up in a traumatic situation, especially if they are soaked in their own blood, because if they've lost that much blood, then their body temperature will drop significantly and you will need to do something about it. So there you go, it's a really good piece of kit to have. So a triangular bandage, or a cravat as some people like to call it. Really, really nice. You can use it as a head wound, or you can use it as a sling. I have no actual experience in using these, so it's basic with basic life support. The actual training didn't come, well, I had at least, didn't actually show you how to use one of these. So again, a Google search and a YouTube video might be very useful for me. But again, I carry one of these in case someone else does know, or if I hurt something, obviously I know people that might do and might help, so it's always good. And then lastly, we have some moleskin. So this is moleskin. You use them for plasters and things like that, and that each bit is like formed into its own little plaster shape, things like that. So as you can see here, it's still got its backing on, so it's already sterile and stuff, but it's literally just like a nice little fabric-y. It's obviously it's a moleskin thing, but it's I don't know what they call it, but it's like a little fabric thing that you can use, place over your blisters, and it saves your feet. So again, we've got some more gloves. So I've got one pair here, one pair there. So these are 2 tongue depressors, or little wooden splints that you can use. Preferably, obviously, use them as tongue depressors. If you're looking down someone's throat, it'd be nice not to use your actual fingers, or get your fingers down in there. So obviously, open the mouth, pull their tongue back, and then obviously you can use that to do that. Especially in something like a situation where you think someone's lodged down someone's throat, getting a nice good view in with it without you having to put your fingers in the mouth. Really nice, because you can do this, but again, just using it with a nice bit of leverage can push the tongue back and help you out nice ton. In here we've got some cotton balls. That's probably the most British thing, or British way of saying it. Cotton balls. Again, just basic things. If someone's been pricked by something and it's bleeding, throw a cotton ball on there and that will do. Obviously it will make this package non-sterile, so hopefully just throw a plaster on it or something rather than having to use these. But again, some cotton balls won't really matter too much. If you want to close it again, just do that. Again, clean the wound as well. 2 pairs of tweezers. We've got some plastic ones here, so these are just less. So if you've got a bigger thing that you can see, you can pull that out with these. And if it's something a bit more fine, you want to use something like these stainless steel tweezers, both of which work obviously well enough, but I would definitely recommend something big. Use your plastic ones for something small and fine. You can disinfect these, do that. But yeah, with these ones, these are one-time use, so should I use them on anyone, they will be going in the bin. With the metal tweezers, I can disinfect these with bleach and different things like that. Obviously, preferably wash off the bleach after I've used it, so I don't, you know, put bleach into a person. But obviously, you can also use disinfectant wipes, I suppose, if you don't want to use bleach. But again, really nice things, and the gloves will go back in there. I'm probably just going to get some more as well and just throw those in there when I get the chance. My door's just attempted to open with the wind, so I do apologise if it does open during the middle of this recording. But nature hates me, so is what it is. And then again, just in this order I've got it, so if anyone does need a sling, that easily available, and that just goes underneath like so. Lastly, and certainly not least, we have the lovely plaster sections. This is where I keep my plasters and different things like that now. So we'll open this. So here we've just got a selection of plasters. So we've got some really big ones, we've got some small ones, some wound closure ones, but the wound closure ones are pretty shit, so I don't tend to use them. But some nice little things. I've got a packet of these downstairs as well, just in our home first aid kit. Really, really nice plasters, work nicely. Here you got an elastic tourniquet for whatever reason, should you need it. Preferably, obviously, use something else. However, the only one I've got at the moment is this elastic one here. So, will I use this in a life-saving situation? Probably not. If someone's got an actual cat tourniquet, then obviously they can use it. But I will probably attach this just in case and stop any other bits, stragglers coming through, or any straggler of bleeding stopping. But I wouldn't recommend it. It's just something I've got at the moment until I can get a cat tourniquet or a soft tube wide, something you know, accepted by the CCCC. Here we have another Cpr Face Shield, really, really nice. This one you can actually see which way it goes in. So this way you put it, this bit you put in the mouth of the patient, and then the other one's on the other side, and you can blow it in, etc. And then lastly we have just some lovely things here. So we've got some what they call cotton tipped applicator. They're just cotton buds with wooden stems, so should you need to, you know, use anything, clean something, etc. We've got some of these, and then I do need to change some of these in here anyway, or add some bits into here, which I will probably do in a second, because I think they're in this drawer if I'm not mistaken, which they are. Lovely. We can add some bits to it. So we've got some, these are just general sting relief pads. So should anyone be stung by a bee or stung by a wasp, then you've got some of those in here. You've got some alcohol prep pads. So if I did need to, or if someone needed some blood taken or anything like that, if they need a finger pricked, you've got some of those. What is it called? I can't think of what the name of it is called now. Blood lancets. You got the, those. I've got some more prep pads here from my drawer. And again, also nice to clean wounds with, like just small scrapes. And then you've got some antiseptic towelettes here, or wound cleaning wipes, whatever you want to call them. Got these ones, and then I've also got some burn care relief. So should I burn myself on a grenade, flash grenade, etc., do really nice things to have. And yeah, so these all go into where I need them. So they go down here. Go in here. Actual. Go here. Tourniquet. Goes in here. And then we have the plasters. Or band-aids, whatever you want to call them, from wherever you're from. It goes in like so. And then how I could pack it up, just to reduce the size a little. I mean, I probably made it a little bit thicker now because I did have it packed really nicely and compact earlier, so I've probably made it a little bit worse now. And then all I have to do is do this, flip down the Velcro, and bosh. There we go, guys. There is my IFAK review, or my in-depth review on what is in my IFAK. If you did enjoy this video, go ahead and drop a like on it, and really appreciated. And yeah, I'll see you guys at some point soon. See you guys later. Peace out.